Okay.
Okay, hello. Great to see you. Thank you for joining us. I am here. My name's Alan Friesen. You might know me as being an employee benefit specialist and of the creator and the founder and the of the Caring Employers Healthy Teams Collaborative. And if you want to know more about that, I'd gladly tell you about it. But today, even more important, we have Dr. Sharon Yannicki. She's with SHENLA, the Social Housing Equity Network, Lethbridge, Alberta. And she is guiding us to basically trying to get more people having enough resources, having enough food, having enough a safe place to stay, having access to medical care, having access to everything in life that we need to be able to enjoy a good life, which includes recreation and family and friends and those kind of things as well. So, Sharon, so glad to have you here. First of all, you should tell us about you because you have an amazing track record, amazing history, amazing educational experience that you've gone through to prepare you to make these changes we want in our community. Tell us.
Sure. So I am a retired academic and a retired nurse. I taught at the University of Lethbridge, and my background is a PhD in nursing. I have 30 years of experience in public health and public health practice. And I care about poverty because I grew up in poverty, and it's something that I experienced as a child, and an education helped me to get out of poverty. So it's something that I've been working on throughout my career. I joined the Social Health Equity Network when it was formed, I think back in 2019, after Vibrant Lethbridge kind of closed in this community. And I think that's kind of a good beginning for me.
Well, I know that you've also spent a lot of time, especially working with folks like Tamarack, in terms of how do you make differences in your community? How do you improve on the lives of people that don't have enough, right? Like, how do we solve those problems? So I know that you spend a lot of time and energy on that as well, and I, very much appreciate your knowledge, your wisdom, and your guidance, kind of how we do these things. Right now, Shenla's done a lot of work on the living wage, right?
Right.
And so there's a living wage that's been calculated basically for every community in the province of Alberta. And our living wage here and our poverty here is huge, right? We have a huge improvement we need to get people out of poverty in our community. Would you agree?
Right, we do. So Shenla joined the Alberta Living Wage Network in 2021, and we hadn't had the living wage calculated in the city of Lethbridge for a period of time. So we really were interested in finding out what was happening to the cost of living for families and individuals in our community. And so that joining the network enabled us to calculate that yearly. And so we looked at that in 2021, and we had a cost of living of $19 an hour. But when we recalculated after the inflationary effects that we've had for the last bit, in 2022, our cost of living had gone up, and the living wage was now $20.30 an hour. So we can see that there's kind of a growing gap between what we pay as the minimum wage in our province and in our community, what it costs to live. And so that growing gap is a concern, and a living wage is something that we're promoting because it enables people to meet their basic needs with dignity and to participate in community life. So that's a really important thing for
Oh
Shenla.
yeah, definitely. I mean, it's one thing about everybody should have a safe place to sleep. Everybody should have enough food in their house, their food, in the cupboard, in the fridge. They got enough to eat. They got enough money coming in to pay their bills, right? But also they need to engage in the community. They need to go out and go to the skating rink and to the, to whatever activity that fills their soul. Maybe it's at the library or wherever it is. Certainly that's part of a full and complete human existence, right? Is that you connect with other human beings and doing things that are important to you. There's how many, oh, go ahead. Sorry, you go.
So I was going to say that that's really important for children.
Yes.
And SHENLA is really concerned about child poverty in our community and how it affects the health and well-being and the future of children. And by paying a living wage, we can enable families to have opportunities for their children to take part in community life in their early years. And that makes a huge difference in early child development. So we're looking at all of those factors that work together in our community to create an equitable and safe place to live for families and children, but also different types of families are included in the calculation for a living wage. So I can tell you a little bit about that. At first, the living wage was calculated only for a two-parent, two-child family, and that was the kind of group that was agreed upon for a standard calculation. That was done all across Canada. But more recently, we've seen as federal and provincial efforts to reduce poverty have really decreased that poverty in that group, in that family type, but other family types have much higher rates of poverty still. And so the calculation now includes a single person and a lone parent family with children. So that is those groups have higher rates of poverty still in our communities. And so by taking a weighted average by family type, then we can calculate something that's comparable across cities in Alberta and across the country. And we can see what it is that we need to pay people an hourly wage that enables them to meet their needs, live with dignity, and participate in the community.
Exactly. Am I remembering this correctly? I believe I recall 47% of Indigenous kids in our community live in poverty. Is that the right number? 47%?
I'm just going to flip to that page.
I think it was
I think
25% overall and 47% as it relates to Indigenous.
47% was for the lone parent families.
The lone parent family. Yes.
Yeah, but that's back in the data that we had when we calculated this for Lethbridge. That was 2019 data. And in the Indigenous families, we only had data back to 2016, and they were at 42% then.
Mm-hmm.
And so we know that that's hugely different than the average for all children, because all children 0 to 17, there's 15% living in poverty in our community. But we see there's really significant differences for some groups and some family types.
And you think about it, that child, like maybe not getting enough to eat, maybe not having a safe place to sleep, maybe not having a parent who has the capacity, I'm not blaming moms, but if somebody's working 15 hours a day at minimum wage to try and meet the bills kind of a thing, well, they got nothing left to give to their kids, right? Just like no energy left, right? And no resources left to be able to, engage with them, have them have the normal experiences of playing and enjoyment and sport and all those kind of things, right? Which are super important for optimal development. Let's put it that way, right?
Yes.
Yeah. I think if I recall correctly, right now there's 3 employers in Lethbridge who have registered as living wage employers. I'm sure there's way more than 3 employers in Lethbridge that would qualify.
Yes.
But so tell us more about that process, Sharon.
So when we began calculating the living wage again in 2021, we encouraged employers to consider becoming registered and recognized provincially as living wage employers. And so the Volunteer Lethbridge, the Lethbridge Food Bank, and there's one more. um, oh, um, uh,
Lethbridge Housing Authority?
no, sorry. It should be right on my list here. I'll flip back to the page.
Oh, United Way. United
United
Way.
Way. Yes.
United Way. United Way.
Sorry.
Lethbridge Food Bank. Yes. Yeah. Okay,
Yeah,
good. I'm with you
that's
there.
right.
Yeah.
And so why is it important for employers to be go through this process of assessing whether they qualify and being recognized as living wage employers? Well, first, it's good for their business, but if you're a group that's already committed to addressing the needs of society, the families in your community, then this might be an important policy that you've already approved and you're already paying a living wage. Then it's helpful for your organization to go through this process and just be recognized. So there's recognition of on the provincial website, and certainly there are people in the community that seek out services and will support businesses that are recognizing themselves as being a living wage employer. So there's many examples and stories on the Alberta Living Wage Network's website of employers and what the benefits are for their business from being a living wage employer. So some of the stories talk about reducing kind of turnover of staff. So if you have employee retention, and it reduces your costs for training, and it improves kind of the working relationships because you have more experienced staff staying on and being dedicated to the work in your organization, your business. So that's an important benefit that that supports your business, but it also means that your employees can actually live in a way that supports their needs, and that also means that it'll support their health and well-being as well.
You bet. You bet. Like, I mean, if you think of it, the way I see it is this: caring employers recognize that their teams are who keep their agency healthy, right? Like their agency has the capacity to do that work if their employees are have what they need, kind of a thing, right?
That's
So
right.
healthy teams, how do you get teams to be healthy? Well, paying them enough is one thing. But if you're already doing that, if you're an employer who already is doing that, which it's what about, you have to be paying $21 an hour roughly, I think, including like that's combination of wages and benefits. It's around there, isn't it?
$20.30 in Lethbridge right now. That's
$20.30.
great.
Yeah.
Yeah. If you're
So
paying above that
yeah,
and you've got benefits, you're definitely meeting this requirement. Get recognized.
exactly.
Register.
Yeah. Why not? I mean, it makes really good sense. And I know from being a consumer, and sometimes I go down to that little Nicaragua coffee shop. Are you familiar with that place on Stafford Drive? Anyways, little Nicaragua coffee shop, beautiful little coffee shop. Well, there they buy their beans from a farm in Nicaragua, and that's actually like the uncle, I believe, of the folks who own it here. So I know when I'm buying a cup of coffee there, the store is doing fine, but the growers who made those beans for me in Nicaragua are have a living wage. They got enough to pay their bills, right? They're, that's a beautiful thing when you think that the actual producer of that has a good living, right? It's not somebody who's getting, shortchanged, or not somebody who can't kind of meet their needs because they're, being squeezed by some huge conglomerate or something. This is where they make sure that they get a fair compensation, which is so that they can have good lives as well, right? Everybody should have all of the opportunities. There's enough for everybody, right? We just got to get it distributed correctly. So, yeah.
Yeah, so that's, fair trade, combined with, living wage, combined with minimum wage, increases that get tied again to, the consumer price index. And so it gets adjusted automatically by inflation so that we're not kind of going down and down and creating this gap, this increasing gap. So back when the minimum wage was set at $15 an hour, it was actually in our community very close to a living wage. But this is the impact of inflation over, the period of time now. And so when you detach if you don't have something that's you know automatically reviewed periodically, if minimum wage is just getting lower and lower all the time, you're negatively impacting people in your community, because then a family needs to work two and a half jobs. Like both parents need to work, and somebody needs to work two jobs in order
Hmm.
to make ends meet. It's
Yeah.
because you're not paying enough for them to actually address all of the needs of their family.
Yeah.
So that
Yeah.
it gets stressful, and it causes a lot of anxiety and distress and worry for families in that situation, always trying to decide, do I where do I cut? It's my food bill is the only flexible thing, so then I have to go to the food bank. Yeah, do I pay this bill this month or leave it? It's just always tough decisions, when you don't have enough.
Well, you and I know from our conversation with with Alberta Health Services, where they're doing some screening of people in terms of their financial situation and how much stress and anxiety that is causing them. Right at the point they're accessing medical care, they have a little questionnaire to ask that question, and makes perfect sense, right? If you're worried about the next bill and the next bill and about paying this and that kind of thing, that's going to be hard for you to be in a kind of a relaxed healing place that you can just kind of navigate through life without, because that's always a worry that that.
Yes.
So how can we make that happen? And certainly if you're an employer who pays a living wage, then register for that and invite other people to invite employees who can enjoy that living wage and have a better life, and attract the customers who say, I want to make sure that the employees of this restaurant, this hairdressing shop, this that are paid a living wage, I want to make sure that they have good lives as well, right? So yeah.
Yes.
Yeah.
Yes, people do actively seek out and support businesses that are acknowledging that they pay a living wage. So it supports your business as well. Yeah.
The membership of Shenla, there is a lot of really smart people around that table. Not me. I'm not saying I'm the smartest person there, because I'm not. You are a lot smarter than I am, Sharon. But the we've got people from the housing authority, right? We've got people from food banks. We've got United Way. We've got like so many agencies, so many academics that want to make this difference, right? How do we structure? What do we do? That kind of a thing. Do we need more people, more voices on Shenla? Do we need representation we don't have right now, do you think, Sharon?
Well, it's always great to have more participation from education, because there's a lot of collaboration that can happen, to support the needs of children, and parent early parenting support services and early childhood development. So we do have, some people that are not able necessarily to attend our meetings, but they follow what we're doing. They read our reports. They'll respond, when we invite panels to come and talk about recommendations that we're making. So whether it's immigrant services, education, all of these groups are very concerned about what the social, issues in our community and child poverty. So working together, we can, create a bigger impact. And so that's something that we are working towards, to actually, have a collaborative planning process in our community that tries to end child poverty and looks at strategies that we can all work on together.
So there is no document that, as an example, the city of Lethbridge says, "Oh, here's our end poverty report. Do these 7 steps." That doesn't exist. Is that correct?
No, that's right. We don't have that. We don't have a, a provincial plan. We have a federal plan, but no provincial plan, and no plan in the city of Lethbridge that we've collaborated on and agreed these are the principles that we want to support in our community and that will help us end poverty. Now, there's lots of research on pathways to ending poverty, and that's, we've learned from working with Tamarack that there's good success in other communities that get this kind of planning and organizing done and then collectively work together. So a living wage is one of the things that we're talking about today that really that that we are promoting as SHENLA as a strategy, and we'd like to see that at the municipal level as well.
Mm-hmm.
So
Mm-hmm.
what would happen if our city chose to create a policy that supported a living wage for all of their employees and all of their contractors?
Yes.
So right now, I'm sure that city employees are, directly working, are largely being paid a living wage. But perhaps not everyone. Perhaps some people, some groups are left out. And I think there are still a few that need to be addressed for the city to consider that. That kind of commitment also, if it's down into, if it crosses all of your contracted workers, then every contract that the city does is preferably done with people who also pay a living wage. And then you start to have a ripple effect that really means more and more people are being lifted out of poverty. Just that kind of a social policy has a big impact at a municipal level.
You bet. No, that makes really good sense. Yeah. And SHENLA is encouraging a municipal plan, a municipal approach, a municipal dedication of resources to kind of make this happen. Correct? That's
Yeah.
the act that SHENLA would have, and pretty makes you'd think that it would be the other way. The city has the plan, and they're looking to SHENLA to help activate, or that's kind of how you think it would work. But whichever way it's going to work, getting on that and making that clear that this is something that we want to make a difference, can make a difference. How do
Yes.
we make a difference? Let's get this done. Right. So, yeah.
Yes.
Cool. Uh, all right. So we talked about the living wage, and our message is if you're already an employer who's paying a living wage, why don't you just register for that program to be regarded as an employer who pays a living wage? You're going to attract people that have said, this is where we want to be. We want to be with an employer who wants to make sure we have a living wage. And you're going to attract clients as well who say, oh, I want to support this coffee shop. I want to support this place here because they pay a living wage. I want to make sure that the people who are taking care of my children, making me a coffee, preparing food for me, that they're going home and they have enough, right? Because
Right.
there's enough for everybody, right? We got to get that figured out. So
Great.
cool. Now, do we have any specific asks? Does SHENLA have any specific asks at this point right now, Sharon? Dr. Yannicki, I should be more formal here. I apologize, Dr. Yannicki.
It's okay. Um, we created a poverty report that was released in the fall of 2022. We have a couple of asks. We would like to, you know, continue to receive support from the city in our working with the Alberta Living Wage Network, so that this calculation is done every year, and that we can continue to share information on what is it really costing us to live, so that people understand how that changes over time and what we can do about those things. We would like to have it regular reporting. The new census came out after our the data came out after our last report. We would love to have that some support from the city to have that report updated. The um, the city, we would like to acknowledge that the city of Lethbridge did support us in completing that report. It was done by Help Seeker in collaboration with SHENLA, and we also had funding from the Government of Canada for that report. So working together, we can kind of keep regular reporting, and that's the only way to know if you're making any progress.
Yeah. You might find this interesting. Yesterday, I was in a little a Zoom session with Dr. Alina Turner from Help Seeker, and it was about Chat GPT and making a difference, like using that in artificial intelligence platform to solve problems in our community, right? And it's not totally figure it out, but it's certainly something that if you had a grant application, as an example, you had to do, you put in the parameters of grant application, and it very intuitively says, boop, 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 here's your answer, kind of thing. Here's your, so, maybe that's a tool that's going to make life easier for people who are applying for grants to help out in our community, right? So, yeah. What do you think of the importance of free or heavily subsidized public transportation in our community? What do you think of that?
SHENLA, that was the top ask, actually, when we presented to the community safety, the SPC.
The acronym that we know who it
is, yeah. on safety and well-being and safety, whichever.
Yeah.
So the top ask was that many children were unable to participate in the community because they didn't have money for bus passes. Transportation was difficult. Maybe after hours, they could get somewhere and not get home. And so we really were encouraging a low-income bus pass, because that Edmonton and Calgary had good results with that policy, but they had provincial government support to implement that. And so we've got that combination coming now, that there was the provincial government committed to that kind of support for other communities in Alberta to create a low-income bus pass. That's really essential. People need to be able to get to work. They need to have, reliable ways of getting to and from work. In our community, when we're doing the calculation for a living wage, we had to say, if you were working shift work or nights, could you actually get to work on our transit system reliably, or could you get home after the end of your shift? And depending on where you live, the answer was no.
Yeah.
And so then in Lethbridge, if you had to have a vehicle, then that needed to be in the calculation for the living wage. So we have a ways to go in making, transportation more accessible in our community. But a really big step was that the city approved funding for a low-income bus pass this year. So we really appreciate that.
Nice. Yeah, that's important. That's important. So anything else we want to share, Sharon?
I think I'll just mention that a minimum wage adjustment is also needed in our province at this point. And when we think about the gap now of $5.30 an hour between minimum wage and a living wage in our community, that it becomes important for us to also advocate that there'd be some adjustments in the minimum wage considered. That needs to be indexed in some way to inflation, so that people aren't falling further and further behind every year.
You bet. And inflation has been, fortunately, you and I are in a position that, okay, it's more money, but we can absorb that extra cost. But if you don't have the capacity, if you don't have the excess in your income to be able to afford that, that's a real challenge. Mm-hmm. I had in the last year, I had a power bill $2,800 for 1 month for a power bill. It's just like, oh my goodness, like I'm in a fortunate situation, I can pay that. But for some people, they'd lose their house, right? I mean, it
Yeah.
just like, those kind of things are bizarre. The inflationary effects we're seeing on food, power, not
Yeah.
so much on fuel anymore, but yeah. So yeah. Okay. So do we want to, Sharon, give your contact information or anything if people want to know more about Shenla or how they reach you? Or
My email address is yanism@uleth.ca.
okay, you know what? I'm just going to put that right in here. Create a banner. yanism@uleth.ca.
Yeah,
Okay. Okay, is that it?
that's right.
All right. So if you want to know more about Shenla and Dr. Sharon Yanicki's work, you can send her an email. Maybe you have a way to participate in Shenla. Maybe you have advice, directions, suggestions. Maybe you have a program that doesn't even need any money and you got some resources that will be able to do that. Sharon is newly on the um, the Community Wellness, Safety, and Security Committee, Advisory Committee. Sharon is new on it. I've been on it for a while. And we just have some new applicants on that. And some of the ones that really encouraged me are the people that said, it's not all about money. There's other things that we can do. We've got time and energy, and how can we make a difference here, kind of a thing. And, maybe some of it even in ending food insecurity type situations is by more donations to the food bank, maybe more donations to the food bank coupled with supporting the food banks in preserving that food, like some freeze dry technology or those kind of things that we can extend that produce, that it lasts longer, and we provide nutritionally diverse foods on a longer period of time, as opposed to processed foods, that kind of a thing. If we can keep mushrooms and plants and vegetables and have them that they have a way longer life, well, maybe we can end food insecurity for families in our community. So
Great.
okay.
Well, thanks very much, Alan. It's been a pleasure chatting with you today.
It has been. I thank you so much, Dr. Yanicki. You are an amazing resource, an amazing community builder, and I'm very grateful to get to know you and to help in my small way on Shenla and with CWSS as well. So thanks, Sharon.
Bye.
See ya. Keep well.